Healthcare is a complicated subject. There's thousands of variables involved, including the patient's genetics and lifestyle, the quality and the accessibility of their healthcare, and the environment and infrastructure of their hometown. The bureaucratic system built around healthcare is also really important, and the efficiency and accessibility of that bureaucracy can mean the difference between life and death for thousands of patients. In the US, we have a for-profit healthcare system. We have private insurance companies whose main purpose is not to provide access to healthcare, but to make a profit for their board and their shareholders. While this system makes a lot of money, it's monstrously unethical, and in many cases, it's outright immoral. That profit is generated at the expense of the sick and injured, and in many cases, people cannot afford their premiums. They can't afford to get sick and injured because the costs for everything are just too high. Even if they did have insurance, they would still have to pay a deductible, which can be thousands of dollars before your health insurance actually kicks in. And even then, you still have copays. Every step of the process is exploitative, and it makes you wonder why the hell you're even paying for insurance if this is how they treat you. Subsequently, it's no surprise that people will generally just avoid going to the doctor. People will just ignore their symptoms, or deal with their diseases or injuries, because going to the doctor or getting medicine can rack up a massive bill. I should point out that the number one cause of personal bankruptcy in the US is caused by medical bills. This avoidance of the doctor leads to terrible health outcomes. People will let their diseases progress and get worse, to the point where treatment is more expensive than it would have been if they got checked out weeks or months or years earlier. The stress over medical costs and health complications can build, to the point where the stress itself is causing a new host of medical and psychological problems. In many cases, because people are scared off by the cost or because they just can't afford treatments, they end up dying needlessly. There was a study that came out a while back that found that in the US, 36,000 people die every year because they can't access healthcare. They can't afford it. The entire system is a corrupt and unethical dumpster fire, which is why there's such intense public pressure for healthcare reform. Bernie Sanders, for example, is running for president in 2020, and a cornerstone of his campaign is Medicare for All, which will build a healthcare system that's cheaper for the average working family and free at the point of sale. In effect, it's a healthcare system that prioritizes people, not profits. Recently, the state of Michigan set up the Healthy Michigan Plan, which was an initiative to expand Medicare coverage to adults living near or below the poverty line. These are people who otherwise would struggle to afford their healthcare, and they are the most likely to avoid going to the doctor because they just can't afford it. A new study conducted by a research team from the University of Michigan Institute for Healthcare Policy and Innovation examined this new plan to see what the real-world outcomes were. The study was published in the Journal of General Internal Medicine. So, the researchers examined more than 4,000 patients who had received healthcare coverage for more than a year under this new plan, and compared them to other Michigan residents who weren't covered. The study focused on chronic ailments, which are long-term health problems known to progress, to get worse over time if they aren't treated. The study found that 68% of these patients, so more than 2/3 of them, had at least one chronic illness, and among these people, 42%, or almost half of them, had only had this chronic illness diagnosed after getting coverage under the expanded Medicare plan. This is really important, because if you don't know that you have a chronic illness, or you know that you have something but you don't know what it is, how can you seek proper treatment? How can you get the appropriate medical care? You can't. But for these people, the expanded coverage gave them this opportunity. For example, among patients with diabetes, or high blood pressure, or a lung disease, or a mental illness like depression, bipolar, or anxiety, a full third of them only had their ailment diagnosed after getting expanded coverage. To highlight the bureaucracy issue, 2/3 of these patients with new diagnoses had been uninsured in the year before the plan was rolled out. So, in effect, these were people who could not get treatment. They could not even get a diagnosis because they couldn't afford it. They couldn't afford insurance. The system as it was had priced them out, and they were left to suffer and die on their own. That is, until the expanded Medicare plan came around. Among all of these patients with chronic illnesses, whether or not they were newly diagnosed under the new plan, a full 2/3 of them said that the new plan gave them better access to prescription drugs. And 90% of them, 90%, said that they were able to finally see a doctor within a year of enrolling. Patients with chronic conditions were more than twice as likely as those without chronic conditions to say that their mental and physical health had improved. Dr. Susan Gould was one of the researchers behind the study. She said, quote, "Michigan's Medicaid expansion emphasizes primary care and health risk assessment, and many enrollees were found to have a chronic condition that will benefit from ongoing treatment. Soon after enrollment, those with chronic conditions reported substantial improvements in access to care and in health compared to before they got Healthy Michigan Plan coverage. Improvements in access and health could well lead to improved quality of life and ability to work and care for family." Unquote. Dr. Anne Marie Rosalind was the lead author of the study, and she said, quote, "For the enrollees with chronic conditions, we were particularly struck that people who reported they had better access to mental health care said their physical health improved more often. This was in addition to health improvements linked to things like better prescription and primary care access." Unquote. This is really good news, and honestly, it shouldn't be too surprising. People who can now reliably get healthcare without fear of being driven to bankruptcy have a lot of stress taken off their shoulders. The fear, the mental fatigue, the uncertainty, it's all gone. People feel more confident and relaxed because they can trust that the healthcare bureaucracy is now working for them, to serve them and improve their health, not to exploit them for profit. They can actually feel secure and safe going to the doctor without fearing for their finances. This stress reduction comes with a whole host of its own health benefits. The study also conducted interviews with many of the enrolled patients, and while a lot of them report improvements in their health and quality of life, what they say is just heartbreaking. Their accounts reveal the horrors of living with an exploitative and unethical healthcare system, and how that system made them suffer needlessly. One man said that he was finally able to get his diabetes under control after being unable to afford medicine for 7 years, saying, quote, "And I feel a lot better," unquote. Yeah, I bet he does, after going without medicine for 7 years. I mean, this is what people are dealing with. This is so unethical, it should be criminal. Another woman who was interviewed said that she wasn't afraid to go to the doctor anymore, so she could, quote, "take care of these situations before they get too bad," unquote. And that's another thing, is that people who are scared to go to the doctor because they can't afford it, they let their illnesses progress, and these progressing illnesses just get worse and worse, and the person suffers more and more until the disease becomes intractable and uncurable, and there's nothing they can do. In many cases, people who are afraid to go to the doctor and who let their illness progress because they can't afford to get it treated, they die. They die needlessly, and their family suffers because of it. The clear and obvious conclusion is that expanded Medicare coverage works. Medicare for all works, and it helps the people who need help the most. This study is just another contribution to the colossal pile of evidence supporting radical healthcare reform in the US, encouraging us to move away from the private insurer model towards a more collective model that distributes care more equitably and improves the health and the quality of life for everyone, not just for those who can afford it.